At Children's, our brain tumor program is dedicated to babies, children, and teens. Because we specialize in pediatrics, we understand their growing bodies both physically and emotionally, and have the instruments and equipment for their needs. We have one of the largest pediatric neurosurgery groups in the country and perform surgeries on more kids and teens with brain tumors than most other pediatric hospitals. Additionally, we care for 375 new cancer patients each year, have one of the leading cancer survivorship programs, and participate in research with other renowned institutions, such as Emory University and Georgia Institute of Technology, to find new treatments and hopefully cures. At Children's, there's an entire team dedicated to caring for children with brain tumors. Our pediatric experts include neurosurgeons, neuro-oncologists, radiation oncologists, endocrinologists, neuropsychologists, pathologists, physical, occupational, and speech therapists, nurses, family support team members. Together, these professionals meet the medical and emotional needs of our patient families.
Prior to surgery, it's always a team effort, but usually most patients come to us through either the emergency room or through a pediatrician's office. And when it's known that they have a mass, then initially they present to the neurosurgeon. We see them and we tell them, we discuss with the family the course of action. Usually that involves biopsy or resection first, and then once we determine the type of tumor it is, we discuss that with the neuro-oncologist.
A pediatric neuro-oncologist is a doctor who supervises the medical care of children with brain tumors. They may recommend radiation and/or chemotherapy as part of a child's treatment plan.
Radiation is an energy beam that is targeted at the individual tumor cells or where the tumor had been, and there might be tumor cells left behind after surgical intervention has been used. Chemotherapy similarly works on cells that are multiplying, and the most traditional chemotherapies actually log jam that mechanism that the cell uses to duplicate itself also.
In operating on children, we take a lot of care, obviously, to make sure that we don't disrupt anything that could affect him later on in life. And so the wonderful thing about Children's Healthcare of Atlanta is that we have this intraoperative MRI scanner. And the intraoperative MRI scanner allows us to tell exactly how much tumor we took out, and if any is left over, if it's safe to go after that piece. We obviously want to do as few operations as possible on children and on any patient, but children especially, and so the intraoperative MRI scanner allows us to do that.
Each year, we follow more than 700 children and young adults with brain tumors. Patients come from all over the country to receive cancer care from Children's. An important part of recovery from a brain tumor is often rehabilitation. Our comprehensive inpatient rehabilitation unit, CIRU, is one of the largest in the country with 28 beds. We offer physical, occupational, speech therapy, and audiology services, physiatry, therapeutic recreation, music therapy, and many other specialized services in a setting dedicated to children and teens. Our rehabilitation philosophy is to help each child, teen, and young adult regain and maintain functional independence. After discharge from the CIRU, we offer options for continued care, such as our day rehabilitation and outpatient rehabilitation programs.
Essentially, we have three large basic science laboratory-based investigative research projects. The first one is a collaboration with Georgia Tech, in which we're looking at nanotechnology, or very small catheters that we can place into the tumor. Without the use of radiation and chemotherapy, we can pull out the tumor cells as a non-invasive strategy to remove brain tumors. A second project is looking at the stem cells of brain tumors. This is a very exciting and hot area of research right now. If we can understand the stem cell, or the seed which gives rise to the entire tumor, and focus our attention and our treatment on the stem cell, we should be able to eradicate the entire tumor, again, without having to use very extensive radiation and chemotherapy, which leads to all the bad side effects that we see with children with brain cancer. A third major research area is looking at how tumor cells spread to different parts of the body, which is also a very important and troubling problem that we face every day with children with brain cancer. We think we have targets which enable tumor cells to move, and we've developed a series of drugs now that will target the tumor cells and keep them from moving, sort of in their tracks. And again, this would be another strategy without radiation or chemotherapy that we could use to just target the tumors.
We are one of only 21 centers in the U.S. that has been designated a Children's Oncology Group Phase 1 institution, giving our patients access to the most cutting-edge treatments available to children with brain tumors.
So we have technology that a lot of other centers don't have. That gives families a lot of peace of mind. One, knowing that the operation, a big part of their child's care, is over and done with on that day. The second thing is that it tells us what the next step is. You know, as a treatment team, we know exactly what to tell the families and what the next step is for them. So from that first day, from that first surgery, you know where you're going, and I think that gives a lot of families peace of mind.
At Children's, we are dedicated to helping kids and teens with brain tumors.